Welcome to Concept Medical Lectures by Dr. Sudarshan. Today's topic is Turner syndrome. Okay, before going in depth about Turner syndrome, just read the disclaimer. I want to describe what will happen in normal chromosome pattern. Normally, we are having 46 chromosomes, means 23 pairs of chromosome. 23 pairs will be there like this. In each pair, two chromosomes will be there. One chromosome is from father, another is from mother, like this. 23 pairs will be there. The last pair of chromosomes can be XX or XY. Those who are having XX will become female, those who are having XY will become male. We are having 23 pairs. First 22 pairs are autosomes. The last pair is called as sex chromosome. This last pair is X chromosome. It can be XX or XY. So what will happen in Turner syndrome is, instead of XX, they'll have one absence of one X chromosome. They'll have X0. So instead of 46, they'll have 45 chromosomes. One X chromosome is absent, so they'll have absence of one X, so that it is written as 45X0. There can be complete absence of X chromosome or partial absence of X chromosome. Partially it will be present and partial will be absent. So they will become Turner syndrome. Got it, right? Normally we are having 46, 23 pairs. Last pair is sex chromosome. Normally we are having double X in females, but in Turner, the last in two X chromosomes, one will be absent completely or one will be partially absent. I'll show in next picture in detail. See, these are the general karyotyping of a Turner syndrome. If you observe carefully, the last one is having absence of one X chromosome, resulting in Turner syndrome. They'll have total of 45 chromosomes. One X is present, other X is absent. This is about Turner syndrome. So, in this Turner syndrome, they'll have completely in entire body 45X0, or there is something called as mosaicism, means few cells will have 45X0 and few cells will be 46XX. Means few cells are normal cells and few cells are 45X0. In a single person, this is just mosaic, means multiple colors. They'll have two types of chromosomes in cells. One cell is having 45X0, other cell will having 46X0. This is called as mosaicism. Few persons will have in a different pattern. Few cells will have 45X0. If you take some other persons, few cells will be 45X0 and few cells will be 45XY. 46XY, sorry. So 46XY and 45X0. So this type of mosaicism also can be there in Turner syndrome. Understood, right? So different cells, multiple cells are there in our body. In that, few cells will be 46XX and few cells will be 45X0. There is some other pattern called as 45X0 and 46XY. So Turner syndrome, this one is taken direct sentence from the standard book. Turner syndrome is complete or partial monosomy of X chromosome. This one you understood. In Down syndrome, advanced maternal age is a risk factor for Down syndrome, but it is not a risk factor or not a predisposing factor for a Turner syndrome. Even advanced maternal age is a just risk factor for Down syndrome, not for Turner syndrome. This much you remember. I'll tell the clinical features of Down syndrome. They'll have edema of the hands and feet, dorsum of the feet. This is called as lymphedema. They'll have broad chest. This is called as shield-shaped chest. And nipples are widely separated. Widely separated nipples. See, the hand is like this, coming like this, and so the hand is deviated out. This is called as valgus deformity. The hand is deviated out. This is called as valgus deformity of the hand. If you go down, there is a dysplasia of the radial distal end of radial bone. The dysplasia of the chondrodysplasia of the distal end of radial bone. Chondrodysplasia. This is called as Madelung deformity. Okay. Like I told, there is a lymphedema of the hands and feet. Even there will be initially there will be edema of the neck, backside of the neck. Okay, which later the edema will get subsided and resulting in folds of skin. See, there is a fold of skin here. This is called as webbing of neck. The mandible part, instead of like this, it is going backward. This is called as retromandibular position. Sorry, retromandibular position. Okay. The hairline usually it will be up to here, but the lower hairline extended further down. This is called as low posterior hairline. The few will have abnormal auricle also. Okay. See, there is a scar here, means they'll have cardiac defects also. He got operated for a cardiac defect. So I'll tell you what are the cardiac defects in next slide. See, I told right there is lymphedema of the both dorsum of the feet and hands. There will be redundant skin here. There is a webbing of neck. There is widely separated nipples. This is also webbing of neck. The ear is protruded forward. There is abnormal auricle here. Okay. I told few cell mosaicism. Few cells will be 45x and few cells will be in a single person. Few cells will be 45x and few cells will be 46xy. That is called as mosaicism. Normally, we describe Turner syndrome as a female phenotype, but in mosaicism, they'll have pseudo hermaphrodite male. Okay, or male or female genitalia will be there in the mosaic child. Why you want to know this thing is they are prone for those who are having this type of mosaicism, they are prone for gonadoblastoma tumor. Okay. Before going in depth about, I'll tell some individual levels. Face wise, they may have retromandibular part. Mandible will be retromandibular. Web neck will be there. Okay, ears may be deformed. Okay, eyes they may have strabismus or squint. Strabismus or squint. So in face, if you take, I am not good artist. Just see, they'll have strabismus or squint. Okay. Then they'll have retromandible. The mandible is restricted back. Okay. Then along with that, if you go to the heart, they'll have bicuspid aortic valve. They'll have coarctation of aorta. They'll have hypoplastic left heart syndrome. If you see all these are arising from the left side. So compared to there is some other thing called as Noonan syndrome. It is almost having similar symptom. They'll have right side defects, whereas in Turner syndrome they'll have left sided defects. In Noonan syndrome they'll have right sided defect. You remember like this, it is easy for you. Among all this, if they ask which is the most common congenital heart defect which is affect in Turner syndrome is bicuspid aortic valve. You can straight away go for this. Okay. Then compared to musculoskeletal deformities, I already told they'll have cubitus valgus. Means suppose this is a body of a child and this is a hand. The hand is deviated out like this. Hand is deviated out. This is called as cubitus valgus. There is a chondrodysplasia of distal end of radius. This is called as Madelung deformity. Few will have shorter fourth metacarpal. If you take 1, 2, 3, 4, 4 is short. The fourth metacarpal will be short. Okay. Few will have shorter fourth metacarpal. Dorsum of the foot is also edematous. This is the foot. Suppose this is dorsum of the foot is edematous. Edematous dorsum of foot. Okay. This is about the musculoskeletal part. Coming to the kidney, main important things I am telling, they'll have multiple features. The kidney lower part is fused. This is called as horseshoe shaped kidney. The lower part of kidney is fused. That is called as horseshoe shaped kidney. Okay. Horseshoe will be like this. So this is called as horseshoe shaped kidney. Okay. Then this is about the main important characteristic features of this thing. Those who are having mosaicism are prone for gonadoblastoma. This much you remember. Blastoma. Okay. Now this is about the clinical features of Turner syndrome. You see, this is taken from standard book, straight away taken as it is. They will have short stature, lymphedema, horseshoe kidney, patellar dislocation. This one you can remember or which can forget, nothing will happen. Increasing carrying angle of elbow, made lung deformity, congenital hip dislocation also will be there. This one you remember extra. The dislocation, the lower hip will be dislocated. They'll have scoliosis. This one also remember. Widespread nipples, seal-shaped chest. Hope we covered everything. Lower posterior hairline, coarctation of aorta, bicuspid aortic valve. Compared to this is the most common. Compared to these two, okay. They'll have hypoplastic left heart syndrome. If you see, all these three are arising from the left heart, in contrast with the Noonan syndrome, where most of them are arising from the right heart. They'll have tumor called as gonadoblastoma. I told they'll have streak gonads. The gonads are streaked in the means not function well in the ovaries are not function well. They will become like a streak in a Turner syndrome. Okay. So the streak gonads will not produce estrogen properly, resulting in infertility and amenorrhea. Okay. Along with that, they'll have the breast development and all is not, secondary sexual characters are not properly developed in the Turner syndrome. Okay, this much you remember. One more extra thing I want to tell is, normally they'll have two X chromosomes. There is something called as, some genes called as homeobox gene. Homeobox gene. This will determine the growth of a child. Now, one X is both side, it will be there, homeobox gene. This will determine the growth of a child. Okay. If one X chromosome is absent, so they'll become short stature. Got it right? Why there is a short stature in a Turner syndrome. Now, how to treat this child? Here only we can tell. See, I told right, the short stature is there. For this, we have to give growth hormone. They'll have gonadal dysgenesis, so we have to give estrogen hormones. Okay. One more thing is, if they're having gonadoblastoma, we'll do gonadectomy. If they're having gonadoblastoma, we'll do gonadectomy. So this is about Turner syndrome. Hope you understood the video. Thank you very much. Thanks for watching. If you want further follow my videos, just subscribe the channel so that you can follow my further videos.